Equitable use of reproductive health care services is of critical importance as it affects women's and children's health. The annual Contraceptive Day raises awareness of birth control and pushes for better education when it comes to sexual and reproductive health care. This is our focus on sound health this week. I am Olasumbo Modupe. Thanks for staying with us. The program begins with COVID-19 update.
The World Health Organization (WHO) is urging leaders attending the 76th session of the United Nations General Assembly (UNGA) to guarantee equitable access to COVID-19 vaccines and other life-saving tools, ensure the world is better prepared to respond to future pandemics, and renew efforts to achieve Sustainable Development Goals (SDGs). Experts say vaccines remain the most critical tool to end the pandemic and save lives and livelihoods. More than 5.7 billion vaccine doses have been administered globally, but 73% of all the doses have been administered in just 10 countries. High-income countries have administered 61 times more doses per inhabitant than low-income countries. The longer vaccine inequity persists, the more the virus will keep circulating and evolving, and the longer the social and economic disruptions will continue. WHO's target is to vaccinate at least 40% of the population of every country by the end of this year and 70% by the middle of next year. These targets are achievable if countries and manufacturers make a genuine commitment to vaccine equity. WHO is calling on countries to fulfill their dose-sharing pledges immediately and to swap their near-term vaccine deliveries with COVAX and AVAT, that is, the African COVID-19 Vaccine Acquisition Task Team. It is also calling on manufacturers to prioritize supplies to COVAX and partners, and for countries and manufacturers to facilitate the sharing of technology, know-how, and intellectual property to support regional vaccine manufacturing. Here in Nigeria, Secretary to the Government of the Federation, Boss Mustapha, has reiterated the seriousness of the federal government's call for mandatory COVID-19 vaccination of all civil servants. He advised Nigerians who are yet to get vaccinated to do so urgently because very soon the federal government will make it mandatory in all government establishments and functions that civil servants are vaccinated.
It is still Sound Health on Lagos Television. Joining me now via Zoom is Omolara Aluko, a sexual and reproductive health communication specialist. Thanks for joining us this evening, Omolara.
Thanks for having me. Good evening, viewers at home. It's a pleasure being on the program.
All right, let's quickly look at reproductive health care in the country. What is your assessment?
Oh, thank you. So, looking at the reproductive health care in Nigeria, basically, if I have to say in terms of giving the rating, I won't say Nigeria has a pass mark. And the reason why I would say that is because so many things are still not in place health-wise in terms of reproductive health. When you are talking about reproductive health, we talk about how many people are aware of the things they need to know, especially women, their reproductive system, the things that could go wrong, how they could use birth control, how they could use family planning in terms of spacing and things like that. So I would say that in terms of awareness, in terms of accessibility, availability of even the personnel, when you look at all these things put together, I would say Nigeria does not really have a pass mark. We are not there yet.
All right, what could be responsible for this situation?
Okay, so well, a lot of things could be responsible. Number one, I would say, is reproductive health. Is it really a focus for the government? If, for example, when COVID came, everything about the other aspects of health was relegated. The focus has been COVID. So even before COVID, what has been the focus of government day in day out in terms of making sure that the needed information, the needed trained personnel, the needed awareness are actually put in place for women and men alike to access reproductive health system. So basically, it's the fact that government does not see it as a priority. It's not really a priority for government. If it is a priority for government, then we wouldn't be saying in terms of assessment that we are not there yet.
All right, the World Health Organization at each forum always advocate the essence of sexual and reproductive health care now. What are the benefits for any country that has a specific, let's say, allocation for this type of services?
Okay, so when we are talking about sexual reproductive health, basically is a right for every woman, for every woman out there. You have that right to make decision to your reproductive health. So when we are not talking about the benefit to a country, I will start by saying, number one, when people are aware about the things they need to know about their sexual reproductive health, it helps a country to control, population explosion. Because when I'm aware of what I need to do in terms of spacing, when I'm aware of my sexual needs and the things, the products and services that I need to use as a young adult, then the issue of unwanted, unplanned pregnancy will not be coming in. And when we also look at it in terms of for a country at large, when you place priority on reproductive health of your citizen, it actually boosts the economy. Why do I say that? Women will have the opportunity of planning in terms of planning for their businesses, planning for their career. Why? Because they have control of their reproductive health. So for any country that places priority on reproductive health, you're actually doing yourself more good. Why? Because you are equipping, you are building a viable economy, an economy where you have healthy people, an economy where you have people plan for their future, an economy where you have, you are not recording, increase in cases of sexually transmitted diseases. You are not increasing, you are not having an increase in the number of maternal mortality. You are not having an increase in the number of, deaths of babies. Why? Because they are, the mother is not healthy enough, or there are not enough facility to cater for such. So, for any country that is doing that, you are actually building a viable economy, you are building a viable population, you are building a future where you have, where your citizen will have a very sound health in order to deliver on their responsibility both to the family and to the society at large.
Okay, so let's look at the role of primary health care, universal access, and health management organizations known as HMO. We know we are preaching healthcare insurance now. We are preaching access to insurance scheme. Now, how do we incorporate this? And let's start with the role of primary health care in all of this before we look at HMOs.
Primary health care is actually, I will look at it from the caregiver, they are the closest to the people. And when I mean they are the closest, they are available in the community. But the question is, do they really have the equipment? Do they really have the wherewithal? Do they really have the information that they need to pass across to these grassroots people? Because, before I will say I want to go to a general hospital or a private hospital, I would have said, okay, well, there's an health center closest to me. Let me visit the health center. So when I visit, the question now arises, the person I'm going to meet, does the person really have information to give to me as per the questions that are, germane to me, the questions that are germane in terms of my reproductive health? So, their role would be that they should be able to provide the needed service as at the time a woman walks into the place to request for that service. Not just the service, they also must be trained. For example, I want to walk in and I need to get, for example, a method of a family planning method. And I get there and the person that I met on seat is telling me, oh, the method you want, I am not trained to provide. This is the other one. What of if the one he or she is preaching to me is one that I've read about that my body cannot really accommodate? So they need to be trained in order to provide those services. And aside that, when we now come to the insurance part, the question is, how many of the HMOs that we have available in Nigeria offer family planning services? There is a need for, for some laws, for some policies to be put in place that this insurance, this HMO will be able to, as they accommodate the likes of malaria treatment, as they accommodate the likes of typhoid treatment, for them to be able to offer family planning as part of the package. Sexual reproductive and things that has to do with my sexual health should be part of the services that any HMO I register with will be able to provide for me. Not that I will walk into a hospital and say, oh, madam, are you on HMO? And I say, yes, I'm on HMO. And I want to do, for example, I want to do like an implant. And they say, oh, sorry, your
package does not cover this.
You have to pay. The fact that I have to pay is enough turn off for me to go and say, oh, I don't even have this money to pay for this service, so let me leave it. And before you know it, what I didn't plan for might occur. So what I will say is that it is high time that the insurance, health insurance policies, put in place something that will provide a coverage, a kind of package for sexual reproductive health, so that anytime I feel there's a need for me to check my sexual health or reproductive health, I am not afraid of the bill. Why? Because I have it covered under my HMO. So there's a need for it to be part of the package. And aside those, being part of the package, there's a need for awareness. So if I'm picking an HMO, I should get a detailed list of what it covers. And when I see the list, they should be able to tell me that, oh, for reproductive health, 1, 2, 3, 4, 5, 6 are the things that it covers, so that when I go to the hospital, I know what to ask for. So there's a need for education, there's a need for information dissemination.
So as the world observed World Contraceptive Day this week, what advice do you have for key players, prospective users of reproductive health care services now, on how to advance this care, these aspects of medicine?
Okay, for key players, I will say that we need reproductive health needs to be at the forefront. You'll be surprised as the universal health
Coverage,
healthcare, as signed in by Nigeria in 2021, says 15% of our budget should be allocated to health. But as at the last budget, it was just 4%. So if we are not allocating enough resources, it means that some part of health, for example, reproductive health, will suffer. You understand? But if the policy makers are doing what is expected, then every aspect of health will be a focus. So now talking about users, for as many intended users, I would say that using a contraceptive method is actually a good way for you to plan. It helps you to plan your future. It helps you to plan your career. It also, help your body. For example, a woman, WHO says you should give at least 2 years in gap between kids. And the situation whereby you have a family planning method in place, it helps you. You would have recovered. The baby also would have grown before you start thinking of getting, pregnant. So I would say that it is actually what is needed by all. We need it so that, all the dreams and aspirations we want to achieve as individual, all the goals that we set out as husband and wife so that we can be able to achieve it. Also, in terms of curbing of sexually transmitted diseases and infection, when you make use of a method like the condoms, it actually helps in preventing that, and thereby we'll be stepping down the tide of an increase in sexually transmitted diseases. And also, if you also want to look at it in terms of awareness, I would say that the youth, we need to create more awareness. Gone are the days that when you don't give your child or you don't give your young adult, a teenager, sexual education. Now is the time. We shouldn't leave it to school. We shouldn't leave it to religious bodies. We need to start from home. You need to educate them about their reproductive organs, about the things they need to know, so that when they go out there, they can make informed decisions about their body.
All right, before I let you go now, I want you to briefly advise members of the public that are still holding on to some myths and misconceptions about contraceptives, and what advice do you have for them now?
Oh, thank you. So, for as many that are still holding on to this myth, I will say, please and please, you need to let go of this myth. What happens to Mr. A or Mrs. A may not likely happen to you. And I will say that when you want to pick a method, try as much as possible. There are resources online that you can read. And when you get to any healthcare provider, please ask questions. Ask questions, tell them your concerns, tell them the things that you feel, oh, these are the things I've heard, and I can bet you they will actually advise you. Because now, a training has been going on in terms of ensuring that there is a proper, adequate counseling before you actually administer any method to any woman. So please, those myths and misconceptions are not true. Because it happens to A does not mean it will happen to you. Why? Because we act in different ways. So please don't let this myth and misconception hinder you. Don't let it put a stop to your dream through unplanned pregnancy. Try as much as possible to read about this method, and when you walk into any healthcare facility, ask questions.
All right, Omolara Aluko, sexual and reproductive health communication specialist. Thank you so much for your time and insight on the program. We really appreciate you.
Thanks for having me. Thank you so much. It's a pleasure being here once again.
All right, Sound Health continues with trending health reports. Please stay tuned. This is where we drop the anchor on today's edition of Sound Health. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social #Sound Health. A sound health is a sound mind. Make healthy living your choice.